Good morning, everyone. It is 9:30, and we're going to go ahead and get started. This morning we have Jim Martin with us from the Division of Public Health, and he's going to talk to us about tobacco and nicotine. So whenever he is ready, we will let Jim get started.
Thank you, Alex. Good morning, everyone, and welcome to the webinar entitled Exploring the New Landscape of Tobacco Products and Nicotine Addiction. And as Alex mentioned, I'm Jim Martin. I'm Director of Policy and Programs with the Tobacco Prevention and Control Branch within the Division of Public Health, Department of Health and Human Services. And it's great to be with you all today as we explore this important topic area. So let's look at the overview of the webinar content today that I'll be sharing with you. We'll first put some context to this and look at the toll of tobacco use in North Carolina as well as the nation. And then begin to get into exploring the landscape of tobacco products as we have and as of late a massive change in the way nicotine is being delivered through tobacco products. And then obviously we'll get into e-cigarettes and specifically talk about Juuls, one of the most popular brands of e-cigarettes, especially among youth and young adults. We'll talk in depth about nicotine addiction, especially as it relates to Juul and other e-cigarettes. We'll address many of the public health concerns that we have with these new products. Then we'll dive into regulation, not only at the federal level, but also talk about state regulations and local policies as at the national and state and local level that we try to get a handle on how these products are, how they're being sold and how they're being used, and how they're in many ways how they're being controlled within communities. I'm going to specifically talk a little bit about tobacco-free schools because this has become a challenge for our schools in compliance with our tobacco-free schools policy. And I'll share some of the things that we're working on within that context. And then we'll examine some other evidence-based strategies and resources that you all can use within not only the community setting, but also school settings as well. And then we'll have ample time at the end for questions and discussion on these topic areas. So let's start off by first giving some context to the tobacco use problem in our country. So if you look back at the turn of the century, you can see over time leading up to the 1964 Surgeon General's report that we had a huge increase in smoking among the U.S. population of adults. And you can see some points along the way that had an impact on those increasing rates of cigarette consumption. And then in 1964, as mentioned, was the first Surgeon General's report on smoking and health that specifically linked smoking with lung cancer. And at that time, about 45% of the population were actually, of adults, were smoking at that point in time. And a little known fact is that the Surgeon General, Luther Terry, the author of that first Surgeon General's report, was actually a cigarette smoker himself. So Dr. Terry, soon after that point in time of the release of that report, was successful in quitting his smoking. And as you can see, as a nation, many adults begin to understand the health consequences of smoking, and we see some other important pinnacle or health events along the way, policy-related measures, as well as other reports showing the health effects negative health effects of smoking on our health, and also the availability of specific medications that can help with individuals to quit smoking. And the Master Settlement Agreement we'll talk about a little bit later. The Family Smoking Prevention and Control Act, which was in 2009, that gave FDA again legal authority to regulate smoking. And you can see that smoking continues to go down. It's a nice downward trend of smoking in our society in the U.S. And again, this is a really good illustration of when the nation understands the health risk and gets behind promoting and communicating those health risks, and also putting policies and other services into place that can help individuals to reduce smoking, which obviously reduces their risk of disease. You can see the success story of the nation here. But unfortunately, we're still in a place where tobacco use is the #1 preventable cause of death. It continues to be. We've made a lot of progress, as you saw in that last slide. But obviously we are still have our work cut out to reduce smoking, especially since it is such an addictive behavior. And so you can see here from this illustration that tobacco kills more people than multiple other types of behavioral health conditions that lead to death. All added up together and combined do not add up to the toll of tobacco use as a behavioral cause of premature death and disability in the U.S. If we look specifically at North Carolina now at our smoking rates among adults, and this is data from the Behavioral Risk Factor Surveillance Survey that's conducted annually in our state, we can see that cigarette smoking continues to decline in North Carolina, and you see actually a decline that's more accelerated from a national perspective. So at 14% for the U.S., this is historically the lowest level that we've seen for cigarette smoking among adults since we've been tracking the data from the turn of the century. So that line that you saw earlier on the continuum for reductions in cigarette smoking in the country continues to go down, which is obviously great news. And as of 10 years, more than 10 years ago, as a nation with Healthy People 2020, we set a goal to get to 12% by 2020 of adult cigarette smoking. And based on the trend line that we are on at this current stage, as a nation, we're hopeful to reach that goal, which would be tremendous. In North Carolina, we set that same goal as part of our Healthy North Carolinians 2020 plan. We still have a long way to go to get down to the 12%. As our state, as you can see, we're at 17.2% right now, which is again above the national average. But we're hoping to continue and accelerate that trend line as much as possible over the next few years as we move forward in reducing smoking among our adult population. The burden of tobacco use is still very, very high in North Carolina, as mentioned earlier. There's still it continues to be 1 out of every 5 deaths in North Carolina are due to tobacco use. And a point that the Surgeon General brought up in the 2014 report was that for every death, there are actually 30 more people that are sick or disabled as a result of their tobacco use, which obviously leads to negative impact on quality of life that we have for those individuals who are in many ways living with chronic diseases that were caused by their smoking or tobacco use behavior. And then, of course, that leads to a tremendous amount of healthcare cost in North Carolina. Treating chronic diseases is not inexpensive. as you well know, and that smoking, again, cost North Carolina $3.81 billion estimated per year in excess healthcare costs. If we specifically look at and dial into the Medicaid costs, estimated $931 million in Medicaid costs as related to treating chronic diseases and conditions that are caused by smoking. And in addition to that, we did a study with Blue Cross Blue Shield a few years ago that looked at the annual cost, excess healthcare cost of health problems due to secondhand smoke. And the data that was published in a peer-reviewed journal showed that estimated cost of $293 million were spent on, again, health conditions that are caused by secondhand smoke. So this is a huge toll on our healthcare system, as well as from a public health perspective. We've been talking about mainly adults and reductions in adult smoking or tobacco use. Now we're going to turn to the prevention side. How do we prevent the initiation of tobacco use to begin with? And if we look at the data, we can clearly see that 90% of all tobacco users start before the age of 18. And if you want to go out a little bit further, 99% start before the age of 26. And therefore, only a small, less than basically 1% of adult users start after the age of 26. So most all of individuals who become adult smokers later on started when they were in their teens. The average age is about 13 for experimentation and beginning to use tobacco products. I would say this is a very early age to understand the health risk, understand addiction of nicotine, and understand the consequences that starting a product when you're 13 and 14 can lead to a lifelong addiction to the product. And so it's a very, again, we have to really work hard to work on our prevention work in working with young people and young adults to help them to understand the risk and nicotine addiction and to convince them that this is a product that they do not want to use or even start in any way. So a lot of that work has been done in this state. North Carolina, beginning in about 2001 through 2012, really invested a tremendous amount of funds from the Master Tobacco Settlement Agreement. And those funds were allocated, if many of you, if you've worked in public health for a while, you're familiar with the Health and Wellness Trust Fund that was set up from the Tobacco Master Settlement Agreement in this state, and in which North Carolina was allocating approximately $17 million to reduce especially cigarette smoking as well as other tobacco product use beginning between 2000 and 2012. And within that time frame, North Carolina not only obviously invested funds into evidence-based practices with lots of work toward policy as well as media as well as cessation services. And this is probably the best slide that I'm going to show you the entire webinar in showing this trend line, which is going in the right direction here in reducing cigarette smoking among our high school students and our middle school students. So if we go back to 1999, and even if we look back into the 90s, we were seeing an upward trend of cigarette smoking in North Carolina among our high school and middle school students. I termed it at that point in time the Joe Camel generation, that we're being convinced that cigarette smoking was a really cool behavior, and you only look as far as cartoon characters like Joe Camel that came along that were promoting cigarette use among youth. So at 31.6% was one of the highest rates historically we had seen in North Carolina among high school students, and then 15% among middle school students. And you can see with concerted efforts with policies and media and program services that are all considered evidence-based, we have contributed to a great decline in cigarette smoking in North Carolina among our high school and middle school students. Now we're down below 10% in high school and 2.5% in middle school, which is, again, a huge public health success story at this point in time. But as we turn to the new chapter, we have to look at this changing landscape of tobacco products, which has changed dramatically in the last basically 5 to 10 years, especially in the last 5 years. Introductions of e-cigarettes to the market have come along since 2007, when they were very first introduced into this country. But as of late, within the last 3 to 5 years, electronic cigarettes again have changed dramatically in their shape and form and delivery of nicotine. And the image here you see is a Juul e-cigarette product, which again has changed the way the device looks and the way again it delivers nicotine to the body. And we'll talk more about Juul in a little while. But what we can see in this changing landscape is that, as mentioned earlier, cigarette smoking has gone down quite considerably among our high school and middle school students, and it was continuing that trend line. But e-cigarette use is going in the opposite direction. Starting out in 2011, we were able to identify just a small number, 1% of middle school and 1.7% of high school students were actually currently using an e-cigarette product, which meant that they were answering the question, have they used the product in the last 30 days? We saw an increase in 2013. And let me back up and say that this data is from the Youth Tobacco Survey data, which we conduct at the state level every other year in the odd years in the fall. And the data that you saw previously on cigarette smoking dating back to 1999 was also a Youth Tobacco Survey. So in 2000, as I mentioned earlier, in 2011, we began to see a little bit of prevalence. 2013, we saw that increase pretty dramatically between 2011 and 2013, especially among high school students, jumping up to 7.7%. And then we saw a much larger spike in 2015. We saw middle schoolers increase up to 7%, and then 16.8% among high school students. And then that seemingly plateaued a little bit between 2015 and 2017. We're currently at almost 17% of high school students are e-cigarette users, and somewhere between 5.3 and then 6% or so of middle school students are using e-cigarettes. But we also look at the box to the right, and when we asked the question in 2017, would students be considering using e-cigarettes in the next year, we had even higher number of high school students reporting that they may be using e-cigarettes or experimenting with them, at 23.3% and 8.7% of middle school students. So if you look at the increase between 2011 and 2017, it adds up to an 894% increase of e-cigarette use among high school students and a 430% increase among middle school students. which is, again, puts us in that proportion of being an epidemic. If we look at e-cigarette use compared to other use of tobacco products in the past 30 days, this is how it breaks down. Again, data from the 2017 North Carolina Youth Tobacco Survey. You see that e-cigarettes, as I pointed out earlier, about 17% among high school students. Then moving down, cigars, cigarillos, little cigars as a category are the second most used tobacco product among youth. 12.7% of high school students, and again, this is very high, are using some form of those types of combustible tobacco products. Cigarettes, as mentioned earlier, a little bit lower at 8.9% among high school. Chewing tobacco, snuff and dip at 6.3%. That number is actually higher in the western part of the state, where it's been much more a part of the culture there. Hookah is at 4.5%. Roll your own cigarettes, and then snus, again, a smokeless product that's been on the market for several years now, at 3.7%. So one thing that we also look at is among these different types of tobacco products is that they're also dual users as well. We may have individuals who are smoking cigarettes but also using e-cigarettes as well, or e-cigarettes and cigars. So there's dual users, and then there's also poly users. Those are youth that are using up to 3 products. And we've also analyzed the data to show that that is happening as well. So kids are getting a pretty extensive amount of nicotine through many of these products, again, especially those that are using multiple products. So if we look at our overall data, again, from the Youth Tobacco Survey, and combine the use of any combine the responses for use of any tobacco products in the past 30 days. Going back to our graph, line graph between 1999 and 2017, it doesn't show such a good picture as I shared with you earlier in regard to cigarette smoking among high school students and middle school students over the same period of time. What you see is a decline in tobacco use until about 2011, and of course then we see the introduction of e-cigarettes, the uptake of e-cigarettes among youth as a tobacco product, and then what you're seeing is the line is increasing, going back up into an upward trend, which is going away from our 2020 Healthy North Carolina objectives to reduce all tobacco product use among our high school students. And so we're moving in the wrong direction here as we see an increase among high school students and e-cigarette users of using tobacco products. So it's really important to know that almost 30% of our high school students are using some form of tobacco products at this point in time. And again, this is largely driven by the e-cigarette epidemic. But as I shared with you earlier, we've seen some uptick in little cigars and cigarillos as well, which has led to, again, increasing these numbers overall. Now I want to share with you a little bit of data from the National Youth Tobacco Survey, and this has the most latest data that they have collected for 2018. As I mentioned earlier, the Youth Tobacco Survey, we're in the field every other year in the fall, so we're gearing up for the 2019 Youth Tobacco Survey now. But if you look at the 2018 data as a nation, there was a huge spike in e-cigarette use among high school students. And so in 2017, the national level was showing that it was at 11.7. And going back to 2016, which was pretty flat at 11.3. In 2015, it was at 16%. So we saw this increase between 2014 and 2015, and then a downward trend in 2016, which we felt like, well, maybe at that point in time, as a nation, youth are understanding the health risk of these products, and so we're beginning to reduce the initiation of e-cigarette use among youth. It leveled out in 2017, but then we saw this huge spike between 2017 and 2018, going from 11.7% up to 20.8%, almost 21%, which equates to 3.6 million users who are underage. This spike, and CDC has attributed this spike mainly to the product Juul being introduced to the market and having a huge increase, especially in the summer of 2017. And so we'll talk a little bit more about Juul. More recently, the FDA, as well as CDC and the U.S. Surgeon General, has termed this huge spike that we saw in 1 year as an epidemic, and they don't use that word lightly. This qualifies very clearly as an epidemic in the U.S., with seeing this huge increase among e-cigarette use among our high school students. Another survey that also documents the problem is the survey that's conducted through the federal government, through University of Michigan, called Monitoring the Future. Many of you are probably familiar with the data collected annually from this survey, because not only does it look at prevalence of tobacco use, but it also tracks many other substances, such as other alcohol, such as alcohol and other drugs. So in Monitoring the Future, the data that they collected in 2016, 2017, and 2018 mirrors exactly the data from the National Youth Tobacco Survey from CDC. And the spike that they saw in e-cigarette use between 2017 and 2018 was the highest spike they had seen of any substance they have been tracking in the last 43 years. Since they have been conducting this survey annually. Never at a time where they've seen any type of use of any type of substance that they've been tracking increase to this level in only just 1 year, over a 1 year period of time. So this gives us a huge amount of concern that we need to be addressing as a nation, as a state, and as a community. So let me just go back and say that a reflection point here is that given the data that we saw from our youth tobacco survey, and given the number of youth that said that they would probably be experimenting with e-cigarettes in the next year, which was again at a little over 23%, I'm of the opinion now that we are, as a state, underestimating the extent of the problem here when we look at the data showing that we have 17% of our high school students using e-cigarettes. Based on this data that we saw, this huge spike in between 2017 and 2018, is that I'm anticipating that our 2019 data is going to show an even higher level than what we see potentially here. So at least above a 20% at this point in time. So again, the 17% is probably underestimating the extent of the problem in North Carolina among e-cigarette use among high school students. So let's go back and look a little bit about these products and kind of how do we get here. So the title of this slide is "No Matter What You Call It, It's an E-Cigarette." And so there's many different shapes and sizes and names for these products that have come on the market in the last decade. Let's go across and look at a couple of these and just talk about them briefly. On the far left is was one of the first products that came on the market, and it basically fit into the category of disposables. The e-cigarette was designed that once the battery life has expired or the nicotine solution that was in the pre-filled cigarette-looking product was used up, then you just basically threw it away or disposed of it. And so that was one of the first generation products that came on the market. Blue changed the technology in the around 2010 or so, and changed really the way the product is being designed. You can still see that the e-cigarette looks like a cigarette, just it's in its shape and size. But the box that you see there in front of you really acted as a device to recharge cartridges that can be bought separately. So replacement cartridges are sold separately once you buy the starter kit, and then the device itself can be recharged, and then the replacement cartridges with nicotine solution would be purchased and so that you can extend the life of the product. So a little bit more technology put into it. And then the third generation came along, which these products were much larger looking. The design of the product is similar in that you have a battery, and then you have a coil which heats up, in the term of an e-cigarette, it's called an atomizer. And then you have a nicotine refillable cartridge. So these, again, you didn't have to buy separate cartridges. You could buy separate containers of e-liquids and then just refill these e-cigarette products so that the cartridge itself or the container can be refilled. These became known as what's called open systems or tank systems. And again, a much larger battery that is able to, the user can inhale a lot more of the e-cigarette aerosol and a lot more hit to the throat area for this. The next generation came along, which were, again, larger devices designed with the same components but looked much differently. These were called mods, kind of short for modifiable products, in that the batteries are much larger. The cartridges, again, are larger. It can be dialed in to a certain level to the battery to heat the coil up to certain temperature levels. These look very different from individuals who are using these types of products. You see somebody using them, I kind of laugh. It looks like somebody's actually using trying to play a musical instrument or something. So really big devices. Youth were beginning to gravitate to some of these devices, but they were big and fairly awkward and sometimes challenging to use. Also risk of many of the batteries overheating in some of these products, and we've seen explosions because of the batteries overheating. And so youth were beginning to gravitate away from using some of these products until the device to the far right came along, the Juul product, and really changed the design of the product significantly from what you see of the previous products, not looking like any type of device that you see before it. Very sleek design, which fits into a category now called USB style device, because a lot of the big tobacco companies and other companies that have been on the market with these types of products for a while are now gravitating toward this new design of the product. So you have the disposables first, and then the rechargeable cartridges next, and then you have tank systems, mods. These were also called vaporizers, personal vaporizers, and tank systems, and then now USB style. As I mentioned earlier, these e-liquids came on the market so that they could be used to refill a lot of the open systems or the tank systems and mods. And very quickly, there was e-liquids began to open up its own market. And there was a peer-reviewed journal in 2014 that showed that in just a short period of time, over 460 brands were introduced to the market. And that came along with all of these unique flavors, especially kid-friendly flavors. And the peer-reviewed journal documented that there were over 7,000 flavors, unique flavors, that had been introduced to the market at that point in time. Interestingly enough, that is a hard number to even put your head around, that there are over 7,700 flavors, unique flavors on the market. And again, most of those are in many ways kid-friendly flavors that have enticed you to use the product. We sent a press release to our department's communications office documenting that there were these unique e-liquid flavors were coming in over 7,000 unique flavors. And then the press office actually sent that, our communications office sent the draft press release back to us a few years ago and actually questioned whether we had a typo in our press release, given that seemed like an extraordinary number of unique flavors. And we clearly documented that it was proven in a published peer-reviewed journal. But again, I speak to many audiences, and they also, many of them, again, often are amazed that with how quickly and the volume of flavors that have been introduced to the market for these types of products. So one thing to really think about here is that what are people inhaling? And these products are also often referred to as vapor products, or that individuals are vaping, using that term, and that came directly from the tobacco industry. Kids often take that as meaning that it's water vapor, and in fact, it's flavored water vapor that they are inhaling. And nothing could be further from the truth. In fact, there's no water in the e-liquid itself. There's as a component that makes up of hydrogen and oxygen or H2O. There's nothing there. This product is basically made up of chemicals, and so what is important to point out is that it's an aerosol. Mainly the chemicals in there are of an oily in a sense, it's oily substance, and we'll get into some of the components of this, what people are inhaling. But again, a takeaway point from today's webinar is that this is an aerosol. It's more closely aligned with products such as a hairspray that people are inhaling, rather than vapor that would be coming off of, for example, a tea kettle. So e-cigarette aerosol, it's not harmless. We have enough scientific research to clearly show that it's not harmless. It does contain potentially harmful constituents, including nicotine. Again, let's start with that fact first of all. So there's nicotine, there's ultrafine particles in this type of oily consistency of chemicals that are being inhaled into the system. Heavy metals can also be found in the product. Many of the products that I described earlier, the coil that heats the liquid and the solvents to turn it into an aerosol, often are manufactured without any standards, and therefore small metals or heavy metals can flake off, and these are microscopic metals that can flake off of the coil within the product that can be then that are unfortunately inhaled into the body. And just through the heating process can also be heavy metals can be produced. The volatile organic compounds are also found in products, and many of those are products like formaldehyde and benzenes, which have been shown to cause cancer in humans. So again, it's important to know that other substances such as propylene glycol and vegetable glycerin, which are the two solvents which act as a mechanism to help the e-liquid turn into an aerosol that can be inhaled once heated, again are substances that we as adults have not been breathing into our systems before. Along with that are the flavors themselves, which are made up of chemicals, and those chemicals can also be very harmful for our bodies. And so not only are flavors enticing, especially our youth, to use the product, they bring along their own health risk when inhaling those products into the lungs. So one important aspect of this as we look toward e-cigarette users is what is happening within the lung capacity of individuals who are using e-cigarettes, and that's just something that's being studied as of very much or extensively in the lab at this point in time and through research. Focusing on nicotine exposure, again, nicotine exposure during adolescence can cause addiction. As I mentioned earlier in the first part of this webinar, is that youth do not understand addiction. One, and I'm probably a lot of you on the webinar are nodding your heads now because you've worked with youth and other young adults who do not understand that what addiction means and what it means to them, and the consequences of addiction, not only with tobacco use but other types of substance abuse issues. So, to give you an example of with cigarette smoking, with kids not understanding addiction, is that an important study that was conducted several years ago really followed a cohort of youth who were cigarette smokers at the time. And one of the important questions that they asked the youth was the question of whether, given that they're current users in high school, would they be smoking 5 years from now? And by and large, only 5% of those high school students who were smoking at the time stated very clearly that they thought they would probably be still smoking 5 years from now. So basically 5%. Again, thinking that in their own minds, this is something that I'm doing now to either look cool or to fit in or, for other reasons, that I'm enjoying doing this at this point in time in high school, but it's something I've just, decided to do now, and that I can give it up anytime I want to, and especially you're looking out 5 years from now, it's not something I think that I will still be doing. Well, they followed the same cohort for 5 years, and what they found was a much different story. In fact, 95% of the cigarette users that were still smoking at that point in time 5 years later. And of course, we know that to be reality because we know adults who are struggling with addiction, who are in their 20s and 30s, 40s, 50s, and 60s, and often battling chronic diseases when they're in those later stages of years, but still fighting with the addiction of tobacco use. And we've all known those people, and many of us have lost those people to that addiction and to the chronic disease that took them away from us. I, for one, from my own family, have lost family members due to tobacco use, and it's really difficult to see that happen. So one other aspect of this is really important for an adolescent is that we have to also realize that nicotine does not react well with the brain while the brain is developing. And it can cause harm to the developing brain very clearly. This has been clearly documented in the science for many, many years now. The main things that we see here is that it's contributing to a negative effect on memory, attention, and focus, especially while that brain is developing, that these pathways are being laid down for addiction. And it also has, again, a negative effect on circuitry that's being developed in the adolescent brain. And as we all know, the adolescent brain is developing up to the age of 25, 26. And so the introduction of nicotine it can be really detrimental at that point, especially through those years of developing brain. So we want to really focus and make sure that kids understand and get across to kids the understanding of addiction, understand the realities of that, and also understand that they are developing, that they are potentially causing harmfulness to their developing brains. And also they're putting a lot of chemicals into their bodies that can cause harm beyond just the nicotine. So let's start looking at the Juul e-cigarette. As I mentioned, a new design that came on the market about 2015 and really took off between 2016 and especially the summer of 2017. As you can see, it's a really small device, fits in the palm of your hand, looks like a USB drive, especially when these products were first being introduced to the market. People did not understand, especially adults, didn't understand what these products even were. Let me give you a little bit of an illustration of adults not knowing what these products, what Juul was, and that it wasn't e-cigarette at all, in comparison with youth beginning to understand these products early on as they saw the marketing and promotion of the Juul product. So one illustration of that is a story that I share with many groups, is that there's a colleague of mine that had a friend of hers who was in a work site setting, and one day she and her colleagues are going to lunch, and they see one of these devices lying on the parking lot, and so they pick it up, and it's this nice little sleek designed product that looks like a USB drive, looks like a flash drive, and so they turn to one another and examine it, and none of the adults here, and among the three of them, knew what the product was. But they said it looks so closely to a flash drive that why don't we hold on to it and we'll take it over to our IT folks at our work site when we get back. Because again, it could have data on it that could be important to our company. So when they got back from lunch, they took it over to the IT folks. This lady took it over. And the IT folks looked at it, and they're again looking at this design of this product, and they're like, we don't know what this is. We don't know what it does. But what we can rule out, in fact, is it's not a flash drive, and it doesn't have any data on it. So as we can determine. So again, it was something that this lady, again, was like curious. I'm not even sure what this product is. So basically, she just stuck it back in her purse. And then about 2 weeks later, she's home and she's with her 14 and 16-year-old daughters. And the lady's fishing around in her purse. The mother is fishing around in her purse to find something, and she couldn't find it. And so what she ended up doing was just emptying the contents of her purse onto the table, again, while her daughters were there onlooking. And so one of the first things that they spotted once they looked at the contents of her purse was this Juul. And they questioned their mother immediately of whether she was using the Juul e-cig product. And probably the term that they used is question their mother, is she Juuling? Because that is a new term that the youth have given to the use of this product, is the term Juuling. So the mother again questions like, what are you talking about and what are you referring to? And so they obviously picked up the product and then began to explain this to their mother about this product as the newest e-cigarette on the market that was all the rave among their peers. And so adults have been slow to understand, even again through that example, you can see that adults and especially parents and again teachers and administrators and other folks within the community, especially adults, have been slow to understand this product and how it's taken hold within our youth over a fairly short period of time without being quite aware of it. In fact, I was speaking the other night to a PTA group, and a parent came up and said that I could find this product in my child's room, probably pick it up, dust around it, straighten up stuff, and put it right back, thinking it was some type of, again, some high-tech product that's being used for computers or something, some device that's holding data, or some device that, again, that plugs into the computer in some way for battery life, or some other mechanism that's a high tech. So again, we need to clearly understand these products and how they're being marketed and again the prevalence of youth, and that how we need to intervene as adults and again adult influencers. So let's dig down a little bit into the Juul sleek design as you saw earlier. So it's a very sleek design. It comes along with resembles a flash drive, as we talked about. Teens say it's definitely more discreet than some of the other bigger products that I shared with you earlier, especially those mods and those tank systems and vape pens. It's really simple to use. The e-liquid is contained in the cartridges that you see that are to the right in the image there, the small cartridges. What you see in front of you is what's called the starter kit. It comes along with the device itself, the metal device, rectangular in form, very small, fits in the palm of your hand. You can see that device will attach to the USB drive there, which can then plug in to recharge the device. And then you can see the cartridges above those four. Those are 4 different flavors in different colors. And they just insert into the end. Once they insert, once the person inhales on the product, it works automatically. There's no on and off button, no switch to it. It's turnkey, really a sleek design. Multiple flavors, and we'll talk about the flavors in just a bit. And as I mentioned earlier, it's not vaping. The term has been used by the youth and young adults as juuling, and that shows a lot of brand loyalty to this product. So there are 8 flavors that have been introduced to the market. Again, they come in these pre-filled cartridges, which Juul refers to as pods. And then each pre-filled pod is equal in nicotine to about 1 pack of cigarettes. So let me repeat that. Each pre-filled pod that you see there, which is about the size of a nickel, is equivalent in nicotine to about 1 pack of cigarettes. So it's delivering a huge amount of nicotine to the user's body in these flavored e-liquid pods. So let's talk about the design of nicotine here. Juul came up with a unique way to deliver nicotine to the body through their device. So if you look at the way that nicotine has been delivered through cigarettes on the right side of this slide, is it's been in the form of free-base nicotine, which is a higher alkaline, delivers through the cigarette, delivers pretty high amount of nicotine to the body, and it's been perfected over years. The first e-cigarettes that came onto the market also used the e-liquid was really, its chemical compound was considered free-base nicotine. And so the nicotine level itself could not be very high in the introduction of these new e-cigarettes that came on the market, because it would be too harsh for the user, for their throat and bronchial area to actually use and it would have a kind of a very irritating effect to the throat area and the bronchial area. So they had to maintain a fairly low level of nicotine within the introduction of the first few generations of e-cigs that came onto the market. Well, Juul changed all of that in many ways. They worked with chemists to chemically change the formula of the way that nicotine is delivered through the e-cigarette. And they found out that by adding benzoic acid to the nicotine, that it changed the chemical compound of nicotine, which converted it into being more acidic and actually being delivered through a low battery source could be more effective in delivering a higher amount of nicotine to the body without having the harshness and irritation to the throat area. So the chemical compound now is known as nicotine salts, and that is something that is now many other manufacturers are beginning to look at how to go from free-base nicotine to nicotine salts, which again puts it more on the acidic side of the pH scale, and which users again can easily inhale off the product from the very beginning and not have a harshness to the throat at the same time, getting a very high level of nicotine into their bodies. So again, as mentioned earlier, one pod of nicotine now delivers up to the highest level is 59 milligrams per milliliter of nicotine to the body, which is double the amount of nicotine that previously was on the market by other e-cig companies. So again, users, especially young users, can find these products very easily to acclimate to, and sets up a user for also delivering a very high amount of addictive nicotine to their bodies. Here's a graph that shows the illustration of Juul compared to cigarettes. And as you know, looking at the addictive quality of cigarettes and the spike that you see from the first time after a puff, and this goes in you can see the scale going in minutes. So you can see that the nicotine is absorbed pretty high level into the body. You get a spike into the system, to the brain, and absorption into the body, and then slowly over time that dissipates. You can see the average e-cig, as I mentioned earlier, had a very low or much lower level using free-base nicotine. But Juul, using nicotine salts, cannot actually mimic that same spike that you get with nicotine delivery through the product. So you have a high level of absorbed nicotine into the body, and then slowly over time that dissipates, in which the user then begins to use the product continuously to continue those spikes up and over. As mentioned, 59 milligrams per milliliter is the highest level that we see, and that's a little bit deceptive in the way that the product is marketed, because the product says 5% strength, and a lot of times if you ask a user what does that mean, they can't really tell you. They can have a sense that 5% is a fairly low number or percentage, but they can't tell you it's 5% of what. So in reality, what that number represents is 5% of the weight of the product. And so, but at the same time, 59 milligrams per milliliter is a huge amount of nicotine that's being delivered to the system. So it's very deceptive in the advertising and the way that's being marketed. And again, youth cannot get their head around that there's that much nicotine. In fact, 2/3 of youth in surveys have said that Juul does not have any nicotine in it, which again is factually incorrect. All Juul products have nicotine. The Juul brand has also come out with a lower level of nicotine more recently at 3%, but again, that's still up at about 39 milligrams per milliliter, which again is still a huge amount of nicotine, even though they've lowered the amount in some of their products that are on the market at this point in time. So before I get to this slide, and I've probably given this away to you, but I've flashed back real quickly to this slide. I want to set the stage a little bit about how this product has been marketed, how the Juul product has been marketed, and why are youth so familiar with the product before adults? Well, we can go back a few years when this product was first being introduced to the market, and again, coming out of a manufacturing plant in California, in the San Francisco Bay Area. So the product line to look at first of all was that if you look at this, he was producing the manufacturer producing a product that mimicked or mirrored cigarettes in their delivery. And one thing that the company first said is that this product is designed and tailored and manufactured specifically for adults. And more specifically, it's for adult cigarette users or those that are using combustible products to change to the Juul e-cigarette product instead. And in turn, the wisdom there was that it could potentially reduce the risk of cigarette smoking and by switching over to this product. And that was really what the company said they were all about. But at the same time, they were beginning to work on marketing strategies. So I want you as participants in this webinar to think of yourself as a marketer. And you've just been hired at this company, and you're to lay out marketing, to lay out a marketing campaign to promote your product. And again, the mission is to deliver a product to adult smokers who want to quit cigarettes or other combustible tobacco and switch over to this product to potentially be a harm reduction product. And so you as a marketer are charged with coming up with that design of what it would look like, how you would reach your audience, what the images would be, and what media platforms would you use? Would you use radio? Could you use TV, magazines? What about social media? What would you be recommending to the company that they use? So here are your images, and how are you going to reach that audience of adult cigarette smokers most effectively to know that this product is on the market? Talk about the design of the product, how it's effective in delivering nicotine to the body, and that it could be effective strategy for those people who are trying to quit smoking. So that's the mission. So I'm sure that all of you have in your mind what those images would look like and where you would be marketing the product to reach that adult population. And so I want to see if this is what you came up with. Is this a design that you had in mind? And I would say that 100% of you did not come up with these designs based on what my charge was to you as a marketer and promotion strategist. So then again, Juul said that it doesn't target teens, and it never has. But again, as this news story says, its early ads tell a much different story. So these are the early days in 2015, 2016, 2017 of the campaign called Vaporized. And this was the way that the product was first introduced to the market. And there were billboards that were in Times Square. There were magazine ads in Vice magazine. But the main way that these images got out, and you can only guess, is that they were through social media, where you saw these images that were beginning to flood the market. And probably many of you, when I ask you to think about what the platform was that you would reach those adult smokers who are trying to quit, you probably thought, okay, social media, let's work through Facebook. Well, there weren't many of these ads on Facebook. These were from Twitter, Instagram and Snapchat. These were where the industry and Juul put all of their marketing campaign that really targeted youth from the very inception. So you can see all these images that were taken directly from the campaign. And here's another image, again, from an advertisement from Juul. Again, that looks very close to the images that we've seen with other cigarette companies promoting their product, where you have young, vibrant, attractive models who are promoting the product. And so all of that advertising campaign called Vaporize then led to a next generation of advertising through youth who are actually using the product, who have begun to use Juul based on the marketing they've seen, and then putting up these types of videos through YouTube. So here's a user, young user, looks underage to me, who is really promoting the Juul through YouTube. And unfortunately, there have been thousands of these types of YouTubers that are out promoting the Juul and talking about the different flavors, talking about how easy it is to use. And unfortunately, this has gone viral out around the entire country and has led to where we see ourselves in an epidemic of especially as a result of use of this product. So a conclusion is that advertising plus flavors have been the magic equation that's led to youth e-cigarette use in North Carolina as well as the country. And in fact, Juul has really taken hold of the e-cigarette market, especially in the last year or so. So if you only go back to March 2018, market share of Juul was expanding at the retail level as Juul began to get out into the convenience stores and being sold in other retail markets, such as grocery stores and other types of retailers that sell tobacco products, as well as vape shops, but mainly through the retail, again, through the retailer outlet. It was only in March 2018 that level of purchasing, among retailers that were being sold was at about 50% or 48% in March of 2018, and as of late, that number has risen to 72% in comparison with the other e-cigarette products that have been on the market, and these are products that have been manufactured and being sold by the big tobacco companies. British American Tobacco, again, owns R.J. Reynolds and their Fuse product. Altria owns Philip Morris and their Mark 10 product, and Imperial Tobacco also owns Blue. So again, as you can tell, that Juul product is outselling those products by far. I mean, I don't think from a consumer perspective and what we've seen from resources such as Wells Fargo reporting, they've never seen a product take hold and push out its competitors so quickly as this product has. And in fact, you probably heard recent news as of December of this past year, Altria, which owns Philip Morris, bought 35% of the Juul brand with an increase in funding to Juul of almost $13 billion. So now Juul and Philip Morris are teaming up together to promote their product, and Philip Morris is pulling their e-cigarette product off the market. So this has led to publications such as you see in the Public Health Law Center as the Juul and the guinea pig generation, because we have youth that are rapidly we've seen a rapid rise in popularity of this product, especially among our youth, which raises a lot of concerns. Nicotine, again, the use in early adolescence, and we talked about changes in the brain that related to short-term effects that can affect over long-term, was looking at brain development, but also can make lifelong addiction much more likely to a young user. An illustration of that is that nicotine often lays out these pathways in the brain to enhance addiction. And analogies that's good to think about is that it almost lays out a pathway like a path through the woods. If you're laying a path, it's much easier for other people to follow that path once that path has been clearly laid out, like on a hiking trail, for example. So the nicotine does a similar thing in the brain, that it lays out a pathway not only for continued nicotine use, but for also other substances such as marijuana and other drug addictions that can easily follow that same path through the same hiking trail in the brain. And so it's very important. It's basically like a hardened pathway that makes that connection to get to those pleasure centers within the brain very efficiently and effectively. So again, nicotine changes that brain pathway in its development and has that effect. So it's important to know that, to make sure that we can prevent kids from ever using any form of nicotine. The other thing is that it's important to know that given the nicotine levels in many of the e-cigarettes equating to cigarettes, is that we may see that pathway expand where kids actually start with e-cigarettes who have never taken up a cigarette, but now gravitate towards cigarettes, and can be something that we're really seriously looking at, because we've seen this downward trend of cigarette smoking downward for several years now, over the past decade. But unfortunately, that progress could be halted by the risk of kids who start using e-cigarettes that were never smokers becoming likely to progress to cigarette smoking over time. And so this is something we're going to be paying very close attention to. So as I've laid out in the previous slides and the content, that we have a lot of public health concerns. The appeal to youth, the flavorings, the social media promotion of these products, the introduction of nicotine to the system, the potential for graduation to not only combustible tobacco products, but also other drugs, harmful to adolescent brain development, toxic exposure of chemicals being inhaled into the body, renormalization of smoking in many ways, where again, people are using these products in places where we haven't seen cigarettes being used, and then delaying quitting among smokers who may be feeling like they can use an e-cigarette to quit, but ultimately end up not being successful and become dual users of e-cigarettes and combustible tobacco products, delaying their use of cessation services that have been known to be effective. Also, exposure to secondhand aerosol, especially among our youth and pregnant women who are especially at high risk of breathing secondhand aerosol. Again, the non-user is being exposed to the same substances, the same chemicals that the user is getting because of the aerosol being exhaled out into the environment. And so the bottom line is that clean air is the standard, and we need to keep it clean and reduce any exposure to obviously secondhand smoke or secondhand aerosol. Another thing that's come along with the e-cig products being introduced in this changing landscape of tobacco products is that we've seen child poisoning. I didn't touch upon this in the presentation, but let me just mention it quickly, is that the e-liquids come in all these multiple flavors, and until a few years ago, the e-liquid containers were just basically bottles that kids could easily get their hands on if they were found in the home, and could open up very easily just by unscrewing the top on the container. Usually they're smelling of the product to begin with. It smells like candy, and then they're unfortunately spilling on their skin or getting them in their mouth, swallowing the e-liquid. The nicotine is very poisonous, and a teaspoon can kill a toddler, and a tablespoon can kill an adult if swallowed, or if that amount is absorbed through the dermal area and through the skin, can also be poisonous. So again, these are poisonous liquids that, if inhaled, well, if swallowed, I should say, or the lethal liquid is absorbed through the skin to a level that can cause seizures, it can cause some major problems. And so we've seen a huge spike in calls to the poison control centers and ER visits as it relates to child poisoning. In North Carolina, the Child Fatality Task Force worked with legislators to pass state legislation to require all e-liquid containers to have child-resistant packaging, and this is something that's been addressed at the national level too. So we're at least hoping that in the short term that these poisonings can go down over time. So let's turn our sights on prevention. So we talked about the problem pretty extensively. Now let's talk about the actual work on prevention, and this is critical. And this is a slide from the Surgeon General's report saying successful multi-component programs prevent young people from starting to use tobacco in the first place, and more than pay for themselves in lives and healthcare costs saved. And again, you all know this. This is very important, working in the prevention world. Let's start a little bit and talk about what's happening at the federal level. First of all, FDA has really identified e-cigarette use as a major problem, especially among our youth, and especially related to Juul. And the commissioner at the time, Dr. Gottlieb, who recently stepped down, but there's a new acting commissioner, Ned Sharpless, has taken his place, and said he continues to want to work very strongly on these actions for FDA to reduce e-cigarette use, especially among our youth. One of the first areas that FDA has invested time, money, and resources is working to reduce retailers from selling these products to minors to begin with. So large-scale, undercover, nationwide blitz of retailers' establishments have been conducted across the state, including North Carolina, sending official requests of information to Juul Labs, requiring the company to submit important documents to better understand the reportedly high rates of youth use, and particularly youth appeal to these products, and then taking steps to foreclose online sales of Juul to minors. So those are some of the steps that have been taken as of late. FDA has also been focused on the appeal of not only access to the product by youth, but the appeal of the flavored e-cigarettes. And again, looking at the 8 flavors that are out there, except for menthol and mint flavors, there's a proposed rule that stores could be restricted from selling these products unless they are sold in an area which is not kids under the age of 18 do not have access to. There's also been a proposal on an outright ban of menthol cigarettes and flavored cigars. This is separate from e-cigarettes, but it would be really, again, an very, very important role for FDA is to, again, reduce the amount of cigarettes that are, or to ban the flavors of menthol and again, with through cigarettes. And then coming back to the access piece, they've been also looking not only at the retail environment, but also the online environment, and trying to beef up efforts for age verification standards for online stores. So this is part of a rulemaking process right now that FDA is going through, and we'll see what comes out of this. I want to turn our sights a little bit also to the Surgeon General, and as I mentioned earlier, the Surgeon General has deemed this as an epidemic that our nation needs to focus attention on. There is, you see in this slide, this is again a still shot of the website, and I encourage you to go to the Surgeon General's website. You can easily Google Surgeon General e-cigarettes and go directly to this site. And I would encourage you to download the Surgeon General advisory that you see on the screen. Easily just click that and get that message. That's an important document that you can share with your colleagues and also in community settings. If you're, again, out there educating parents educating, working with the schools, working with other community groups. It's a really nice advisory that, again, can be shared as an educational tool, and I really encourage you to go to that. Also, taking information from this site is again, there's lots of information set up, especially for parents who need to be really educated on the facts regarding e-cigarette among their kids. So really, I encourage you to go to this site. So let's turn our sights on now looking at the state and the local level. Here's an illustration to really look at what's effective in tobacco use prevention. And CDC adopted this graphic a couple years ago of analogy of having a tobacco control vaccine. And in public health, obviously, we rely on vaccines often to inoculate users to prevent disease from ever occurring. This is an illustration of what would be as part of that vaccine to help prevent and reduce tobacco use, especially among youth and young adults. And so 100% smoke-free, tobacco-free policies, including e-cigarettes, and we'll talk about that. Easy access to tobacco treatment, funding, price increases on the product, preventing access to the tobacco products, and then hard-hitting and helpful media campaigns. And I'm going to run through a few examples to illustrate each of these areas. So first of all, we have a lot of new policies that are being adopted at the local level by counties, through the Board of County Commissioners, through ordinances. We also have municipalities. The cities and towns are developing ordinances as well to especially reduce e-cigarette use in places where smoking and other tobacco products have been prohibited. So you're beginning to see new signs that are going up that are also including e-cigarettes. And this is important to really change the social norm very quickly to make sure that people understand that these products are not to be used in certain areas, especially where you're exposing other individuals to the e-cig aerosol. So again, we're beginning to really work very diligently at this with local decision makers. And I encourage you to work with your local decision makers to work on policies at the worksite setting, at the community setting, that can also include e-cigarettes within those policies. With tobacco-free schools, just a little bit of history here, and many of you may know this, is that in North Carolina, we began working on having tobacco-free school campuses around 2000, especially when we had such an epidemic of smoking among our high school, middle school students, which you saw illustrated earlier. And so we worked with the governor at the time, and we worked with youth, and we held a huge summit in Charlotte with about 800 folks coming together to work on solutions to reduce cigarette smoking on our, especially on our school campuses, but obviously to overall just prevent and reduce cigarette smoking among youth, middle school and high school students. And one of the big things that came up within that work was having our campuses be tobacco-free, meaning at all times our students and staff and visitors that smoking and other tobacco products were prohibited. And school district by school district began to work on passing local policies for their school district that prohibited, at that time, cigarette smoking and other tobacco products. So by 2007, we had 87 out of 115 school districts that had already passed policies to prohibit all tobacco products use on their campuses, and this was going really, really well. And again, it made a lot of change. It made a change in the environment. It made it where that if kids got a prevention message in the classroom, they didn't go outside and see a different message on their campus, or they didn't go to a football game on a Friday evening and see smoking behavior in which, again, seemingly being condoned and also teaching the behavior in many ways, as adults were role modeling the behavior, or they didn't see teachers out in designated areas on the campus smoking, which again sent a mixed message to the students. And so we began to set up really healthy norms on our campuses. So by 2008 or 2007, as I mentioned, 87 out of 115 school districts were tobacco-free, and there was state legislation that Senator Purcell, who was a physician and pediatrician, introduced and was passed overwhelmingly to bring along all the other school districts to make all schools in North Carolina smoke tobacco-free campuses. And so more recently, we celebrated the 10th year anniversary of that law. But as of late, these new products have been coming on the market, as we've talked about in depth, and hard for principals and administrators and also teachers to even detect these products and understand them, since they're so easily concealed, are not combustible products, and also they don't give off a lot of fragrance or odor to them, and therefore they're very challenging to detect, and also to make sure that the schools are in compliance. But as schools are beginning to understand these products and put more emphasis on reducing e-cigarettes coming onto their campus and preventing e-cigarette use in general, we began to put more of a focus on the policy itself, knowing that tobacco-free means tobacco-free, and that e-cigarettes are tobacco products, and they're also are prohibited on campus. We're in the process of getting brand new signs up for all the schools in the entire state, and each high school will be getting 3 new signs. The middle school will be getting signs, and high schools will be getting signs. And you can see the illustration of this sign here on the slide. This is our Tobacco-Free Schools website, so if any of you are working with schools and they're being challenged with compliance with policy work, as it relates to e-cigarettes being on their campus, and I encourage you to have them go to this site for very valuable information and tools and resources. There's also a letter here about prohibiting e-cigarettes on campus, and also some of the resources that I'm going to share with you in just a few minutes are all laid out in a letter that's posted on this website that went to superintendents back in February. So again, I encourage you to go to this site, especially get the letter, because we have a lot of resources that have hyperlinks to the actual sources of information. So I encourage you to go to get this information. So again, you can easily Google it, but it is just www.nctobaccofreeschools.org is the site. One of the pieces within that letter that we're really promoting, and we've been promoting this through trainings across the state, is a free curricula to schools to address the juul and e-cig epidemic, and it's called Catch My Breath. It's really a prevention curricula, prevention program that's either really youth-centered. It's been shown to be effective and in the classroom, and this is for teachers and tobacco educators, counselors, and nurses. So I encourage all of you to go. You can easily Google Catch My Breath Youth E-Cig Prevention Program and see all the valuable resources that's online. This program is funded through the CVS Health Foundation. Once the CVS stops selling tobacco products in their pharmacies, they have invested $50 million in making the next generation tobacco-free, and so they're putting a lot of emphasis on reducing cigarette smoking and other tobacco product use, but also especially e-cigarette use among our youth. So I really encourage you to look at this curricula that's out there. And again, we've been promoting it throughout the state, and Department of Public Instruction has also been promoting it through the Healthy Schools Initiative. Another program that's out there is called Aspire. This is by the MD Anderson Cancer Center, and they've designed a product which also functions as an educational program for online for school settings, But we've often promoted this product, this educational product to schools who are finding youth who are violating the policy and are, again, once a violation occurs, schools are taking the products away from the youth. We encourage them to contact the parents, let them know about the use of e-cigarettes by their son or daughter on the school setting. Have a meeting with the parents to talk about this and to educate at the same time. Also, youth can go through this educational program called Aspire online to really have an educational presentation that's given online about e-cigarettes and all tobacco products, and to get them more educated, and also to try to move them toward quitting or no longer using these types of products. So this is another product educational program that's out there. This one has been endorsed through SAMHSA as well as an evidence-based educational program. I also want to bring your attention to another curricula that's been developed called the Stanford Medicine Tobacco Prevention Toolkit. Has modules for tobacco and nicotine addiction education. And this is a really good site as well at, again, med.stanford.edu, and it's /tobacco prevention toolkit /e-cigs. But one of the easiest ways to get there, of course, is just to Google it, Stanford Medicine Tobacco Prevention Toolkit. This has, again, a wealth of information and resources for you all who are working in the prevention field as it relates to nicotine addiction, positive youth development, and also a huge section on e-cigs that are that's being closely monitored and updated, because we see this field, changing quite dramatically in short periods of time, and we want to, and the researchers and professors at Stanford Medicine really want to work on continuing this and keep their product as up to date as possible, and they have the opportunity to do that since everything is online. I will say that the Department of Education in California is now using this toolkit throughout their state to try to combat this epidemic from an educational perspective. Our current quit line, many of you are very familiar with this. It's an effective way of reaching our adults who are trying to quit, and through extensive coaching, through experts, and working through combination therapy of nicotine replacement therapy, and through calls and receiving therapy through the mail. And there's also been a protocol set up specifically for pregnant women. And we've also, as of late, been working with the Quit Line to set up more ways of reaching not only adults, but also especially youth through texting and web only, rather than just using a telephone or your cell phone. So again, this is an effective resource, and again, you can go to Quitline NC to get very valuable information from that website as well on our Quitline services. A new resource that's out there that I would encourage you all to promote is, especially those of you who are working with teens, to curb the teen e-cig epidemic, is a texting format for cessation. This has been really closely developed through the Truth Initiative over the last few years, working with researchers and working with youth. It's been thoroughly vetted so that you see messages, text messages that youth who sign up for the program can receive through their phones. The example here, it's hard to not jewel in places where you're not supposed to, like school, reply yes or no, and then it continues to begin to give text messages back and forth to the user. But you all can also text QUIT to the number that you see on the screen, 202-804-9884, anonymously. And you can sign up to also receive free messages that can either, if you're trying to to quit tobacco use, or you're trying to help with a friend or a colleague, or you're trying to promote this program so that you know a lot more about it. You can use it yourself. So again, we've seen a lot of uptick of this users, especially among youth and young adults, with these tailored daily text messages to support and tips for quitting. So again, Truth has really worked a lot with the young people, and because we have, again, a large number of youth who are becoming highly addicted to nicotine, who need to be convinced that it's important to begin thinking about quitting, and the earlier the better, and these programs and messages have been shown to be effective. I pointed out earlier that funding is desperately needed to address this issue as well, and so from a state perspective, many of you have worked in the field for a while, are well aware that our state was, and I mentioned this earlier, our state was spending or investing dollars from the Tobacco Master Settlement Agreement into prevention funds. And between basically 2005 and 2012, the state was spending between $15 million and $18 million to really work on tobacco use prevention, and you can see that those evidence-based strategies that were put into place through coalition work at the local and regional level, through policy work at the school and community level, through a multimedia, again, education and prevention campaign, reducing access to e-cigs, and as well, not e-cigs necessarily, but all cigarettes and other tobacco products, that we saw tobacco use rates begin to go down. But then because of other budget issues and other factors, the money was zeroed out in the 2011-2012 legislative session. And so the prevention dollars from a state perspective went down to zero. Over time, the numbers have come back up slightly, but that's mostly been for the Quitline services that I mentioned earlier through Quitline NC. As of this year, in the fiscal year 2017, 2018, last year, and then this year, the legislature has appropriated $500,000, and then for 2017, 2018, and then for 2018, 2019, there was $750,000 that was allocated, appropriated for tobacco use prevention. But unfortunately, this emergence of e-cigarettes that we've talked about throughout this webinar occurred during that same period in which the monies went to zero, and so the monies have been a lesser amount in comparison, obviously, to what was being funded earlier, and it's been challenging to have the amount of resources needed to combat this issue. So I, again, encourage you to work as much as possible effectively at the local level on evidence-based strategies and try to incorporate those in as much as possible within the resources that you all are working on. And then just at the bottom is that just a reminder from the Tobacco Master Settlement Agreement is since 2001, our state has averaged over $149 million per year from the settlement agreement, and we continue to get approximately that amount of money each year. Just as a reminder that this is money coming from the tobacco companies to pay for prevention programs for tobacco use prevention that are often not really being allocated or appropriated at this point in time by using those funds. I mentioned media as an effective strategy through the dollars that I mentioned earlier as part of the $750,000 that were been appropriated for this fiscal year. We're investing resources into reaching kids, especially through social media, through working with a group called Rescue. And they have been working very closely with our colleagues in tobacco use prevention and controlling in Virginia and also in South Carolina and Connecticut and in multiple other states. And the uniqueness of their design is that in their tailored media and social media is that they have really worked on scientifically showing that in the U.S., no matter where you go, in the U.S., if you go to any cafeteria in high school across the country, you basically find that there are 5 peer crowds. And this is based on, again, the types of lifestyles that these youth have grown up in or part of, and the things that they really enjoy doing, and from the type of music, from the type of activities or recreational activities, to the types of things that are important to them. So you can see that that mainly youth fall into one or more of these peer groups. You have mainstream, which is the largest group, and then popular, which is the second largest, and then hip hop, country, and alternative. And so what the rescue does is with those peer crowds is then they try to design and work on focus group tested media that really reach out to those peer groups where they traditionally work or are reaching through their peer groups and through social media, where they go for their information and types of events they're involved in to produce prevention messages. And so this is an example of a campaign that we're investing in right now through our Department of Health and Human Services, called Down and Dirty, a tobacco prevention campaign for country kids. And so there's media running through social media right now that's really reaching out to these youth, and we've had a large number of youth that have been reached, and with using a fairly small amount of money, but effectively using it and strategically targeting it through these social media platforms. Access to, let me turn to access to the product, to tobacco products. As you all know, most of you have been involved to a large extent or a lesser extent in our efforts to reduce sales to minors in the state through the SINAR work that our Division of Mental Health, Developmental Disabilities, and Substance Abuse Services has been is the lead in, taking the lead in, and we work very closely, obviously, with that sister agency. One of the work, we're working very diligently right now to get the law that we have in place right now, which restricts sales of tobacco products to anyone under the age of 18, by working on education with retailers and also working on enforcement action through alcohol law enforcement. So, as you all probably are well aware of, there's been a lot of work and continues to be a lot of work on this area. Another thing that's coming up across the country is the benefit of raising the age from 18 up to 21, the legal age. So thus far, we've had several states and hundreds of local communities that have passed local regulations to raise the age from 18 to 21. And there was an Institute of Medicine report just a few years ago that clearly documented the main benefit of this would be prevention, especially with younger youth who are like 13, 14, 15, 16. It would make it much more challenging for them to potentially pass as a 21-year-old, and if they're going into a retail store and trying to attempt to purchase. It would also reduce social sources of especially tobacco products, and especially e-cigarettes among high school students. One thing that we know is that kids can often get their hands on e-cigarettes by getting them from other legal adults who can purchase the product at 18 and then distribute those to their friends or sell them to their friends or sell them to other students, for example. So by passing a law, and again, not just a law, but strengthening even the law that we have in place right now with provisions that make it illegal to sell to anyone under 18, but to add pieces like licensing and other measures that would make the law effective and then raise the age at the same time can be important for, again, reducing those potential 18-year-olds who turn 18 during their senior year in high school who are legally purchasing multiple quantities of, for example, Juul, and then going back and distributing or selling it, as I mentioned. So this can, again, have a positive effect. you see that Virginia is on the map, and they recently passed a law to raise the age up to 21. However, their law didn't contain a lot of strong provisions within it, and so we'll have to see if that law it still remains effective. And in other words, what we've heard very clearly is that it's more than just striking out 18 and putting 21. You really need to examine the law and the effective measures within that law to make sure that it can be enforced very well, and that it's again, that the sales to, if you raise the age up to 21, that the sales to anyone under the age of 21 are very, very small. I wanted to also point out very clearly this map, and no matter where you're located in the state, you're covered by one of our regional managers. And hopefully many of you who are on this webinar have already reached out to the managers within your region. These folks are very, very valuable to work with you at your local community level on prevention efforts, again, at the school or at the community level. And so I would encourage you to make sure that as a result of this webinar that you reach out to the region, make sure that you introduce yourself to the regional manager. Hopefully you all can meet one another in person and talk about where there's overlapping work that you all are doing as you work on either the access issue or prevention messages at the school setting or community setting, and work together potentially on policy work as well. So again, I encourage you to, again, reach out to these very well trained and outstanding staff that we have working at a regional level in tobacco use prevention. Here's the contact information that for our state staff, and you can see my information here. If you have additional follow-up information that you'd like to share after this, or questions that you have after this webinar, feel free to send me an email, and I will be glad to get back in touch with you, and also would be glad to, again, work with you on any type of regional training that you've been working on. And we can also work with our regional managers, as pointed out in the last slide, if you're working on trying to, again, working on prevention messages, working on training to work with adult influencers, working with PTAs, working with healthcare providers, working with substance abuse providers, again, to educate them and make sure that they can become strong leaders in their community on this prevention work. We'll be glad to work with you in any way. So, Alex, that's the end of my content. I'll open it up to you to facilitate any questions that folks may have. And again, if there are questions that you have, you think of later on after you're looking at the materials, or you've digested some of the things that I've said today, if you have, again, additional information or questions, you can easily follow up with me by email. Again, I'll put my information back up on the screen for you. So, Alex, I'll turn it back to you.
All righty. Thank you very much for your time today. I don't see any questions right now. Wait, one just popped up. Okay. Has there been any studies on how e-cig and/or Juul affects a fetus?
Oh, good point. Yes, and harmful effects there. Pregnant women should be really strongly educated that nicotine can have a very negative effect on fetuses, especially the developing brain of the fetus. A program that is being also funded through some of the state appropriations right now is a program called You Quit to Quit. So I would encourage you to, again, very easily Google that. It's You Quit to, TWO, to quit. So it's a program that was launched in the early inception when the Health and Wellness Trust Fund was in operation to really strategically work especially with healthcare providers across the state who are working with pregnant women to understand the health risk of any type of tobacco use, including now e-cigarette use, about using those products in preconception as well as during any time during pregnancy. So many of the products now have come along with strong warnings as it relates to not using these products while being pregnant. But I would encourage you within that topic area to really get valuable information that's on the website at uQuit2Quit, again, which is housed over at UNC Chapel Hill through their maternal and child health programs. So great question. And yes, we want to really discourage, especially pregnant women who think that e-cigarette use could be in many ways less harmful, or trying to use it as a substitute from potential combustible tobacco products during their pregnancy. We want to make sure that they are convinced that no products, combustible or non-combustible, containing e-cigarettes should be used at any point in time, preconception or during conception time and during pregnancy, so especially during pregnancy. And then also after pregnancy, making sure that especially the mothers and the families understand that using e-cigarettes around their youth are, again, exposing them to chemicals through the secondhand aerosol and even third-hand aerosol, which can get on clothing and also fabrics. Again, I mentioned that the solvents within the e-cigarettes are kind of an oily nature, and they tend to adhere to substances very easily. If you've ever been in a vape shop, you can only talk to the owner to know that they have to really wipe down their counters and other parts of the shop each day, given that those oily droplets adhere to and create a residue on much of the parts of the shop itself. And so you can only imagine those getting on the clothing and then getting also easily being transferred to an infant. So really encourage you to go to uQuit2Quit, to that site, and look for the information that they have produced as it relates to working with pregnant women as it relates to preventing e-cigarette use, especially among those women. Good question. Great question.
Alrighty, I do not have any more questions showing up at the moment. I'll leave it up for a little bit longer, and then we will close it for the day. In about an hour, everyone will receive a link for a survey, so if you will complete that for us, that would be great.
Let me just say I appreciate the time and being with you and having enough time to really walk through a lot of this information this morning. I see we have over 50 attendees, so I would again encourage you to take this information that you learned today, continue to look at the additional websites that I mentioned as well, and really become strong leaders in your community to work on this epidemic. We're going to need us all working together to address this issue and on multiple fronts. It's going to take a multi-component effort to turn this trend line, to even flatten it out and then turn it around so that we can begin to, again, prevent and reduce overall tobacco use, and especially e-cigarettes among our youth. So again, I appreciate everybody's time and putting and listening into this webinar, and I hope the information that you've received is very valuable to you, and you can take the next steps to think about what your role can be in your own communities to take this information and really try to, again, address this through evidence-based solutions. So I really appreciate the time with you all. Thank you.
Alrighty, thank you everybody. I hope you have a good rest of your day. I'm going to go ahead and close it out.
Thank you, Alex, and also shout out to John. Thanks for him for requesting this webinar, and I appreciate y'all's coordination and organization on it. So thank you.
Thank you very much.
Right. Have a great day, everyone. Bye-bye.